TropoVet PRP is a next-generation regenerative therapy designed specifically for veterinary medicine. It allows practices to harness the animal's own biology to accelerate healing, reduce pain, and improve outcomes, without surgery, implants, or pharmaceuticals. Today I'll show you what TropoVet PRP is, how it works, and why it should be part of your practice. Every day in veterinary practice we see osteoarthritis, ligament injuries, and wounds that simply won't heal. While medications reduce discomfort, they do little to restore damaged tissue. TropoVet PRP fills this gap by harnessing the animal's own platelets to stimulate true regeneration, accelerating recovery instead of just managing symptoms. TropoVet PRP is produced from a small blood draw and processed directly in the clinic. Using a patented gel separation technology, the system isolates platelets while significantly reducing red blood cells and excessive neutrophils, cell types associated with post-injection discomfort and tissue irritation. The result is a high-concentration, monocyte-rich PRP designed to support the body's natural repair processes by delivering growth factors directly to injured tissue. This allows clinicians to provide a biologically optimized treatment that enhances healing while minimizing unnecessary inflammatory response. Not all PRP is the same. Clinical outcomes depend on both platelet concentration and cell composition. Higher platelet doses deliver greater amounts of growth factors to the target tissue. Red blood cells and excess neutrophils are associated with inflammatory responses after injection. TropoVet PRP is engineered to minimize these cells while preserving beneficial monocytes, creating a more controlled biological environment that supports tissue recovery and repair. TropoVet PRP delivers predictable, technically defined PRP. Depending on kit size, clinicians can generate between 1 and 10 billion platelets per treatment. This consistency allows you to match PRP dose to the indication, whether treating a small canine joint or an equine tendon lesion. TropoVet PRP is extremely versatile. It's used successfully across species for orthopedic injuries, joint disease, wound healing, ocular conditions, and surgical recovery. This versatility allows a single system to serve multiple service lines within your practice. While PRP literature spans decades, TropoVet PRP builds on this foundation with controlled platelet separation and consistent outputs. Clinical cases, including equine tendon healing, chronic wound closure, and corneal ulcer recovery, demonstrate meaningful, observable improvement using TropoVet PRP protocols. TropoVet PRP was engineered with one purpose: to deliver a clinically meaningful platelet dose, not just higher concentration. When 322 milliliters tubes are processed together, the resulting PRP contains an average of 12.3 billion platelets in just 5.2 milliliters of plasma, achieving over 80% platelet recovery. That translates to a higher growth factor dose delivered exactly where it's needed. Building on this performance, the new 40 milliliters TropoVet kit delivers the same results in a single tube. With one venipuncture, clinicians can obtain up to 10 billion platelets and up to 24 milliliters of PRP, while maintaining the same single-spin workflow and neutrophil-poor, RBC-free, monocyte-rich profile. No protocol changes, no new equipment, no retraining. This gives your practice the flexibility to treat bilateral joints or multiple sites from a single preparation, efficiently and confidently. More platelets, more options, same workflow. TropoVet PRP was designed for real-world veterinary practices. The workflow is straightforward, repeatable, and fast, often completed in under 15 minutes. No complicated manipulation, no complex protocols, and no second spins. This makes it easy to delegate to trained staff while maintaining consistent results. We will now demonstrate the PRP process.
Begin by performing a standard venipuncture using the butterfly collection set supplied in the TropoVet PRP kit. Draw whole blood directly into the vacuum-filled TropoVet PRP tube. Immediately after collection, gently invert the tube about 10 times to mix the anticoagulant. Next, place the PRP tube and a properly prepared balance tube into the transcend axis centrifuge, making sure the water level in the balance tube matches the blood level. Spin for 10 minutes at a speed of 1500 RCF. After centrifugation, gently remove the tube and place upright in the tube rack. The blood is now separated. Notice that the red blood cells and granulocytes are captured below the gel, and the desirable platelets are sitting just above the gel separator, with over 80% of the platelets directly above the gel. Next, insert the filtered vent needle into the airspace and attach the 65mm needle to a 10mm syringe. Slowly remove the plasma from the top down until you have the desired volume. You are now ready to collect the PRP. Attach the 41-micron filter disc to a new collection syringe and connect it to the extraction needle. Gently suspend the platelets by tilting the tube to about a 15-degree angle and slowly inverting it back and forth 15 times as shown. Now, draw the PRP into the collection syringe. Remove the syringe, secure the cap, and place it on the tube rack until you are ready to use it.
The TropoVet workflow is intentionally simple, making it easy to integrate and delegate within a busy practice. The system is available in 3 purpose-built formats: 11 milliliters kits for smaller animals and joints, 22 milliliters kits for larger patients with a tube specially formulated for equine use, and the new 40 milliliters kit designed for equine higher volume cases. This range allows you to precisely match blood draw and PRP yield to each procedure while standardizing on a single validated separation technology without changing your protocol or equipment. Beyond the system itself, Transcend supports your team with structured online training and optional certification programs to ensure consistent, repeatable PRP preparation. You'll also receive access to a practical marketing toolkit with customizable patient materials and digital assets to clearly communicate your PRP services. In addition, Transcend's loyalty program rewards ongoing use, with each point equal to $1.50 points automatically added with your initial system order, providing immediate value and long-term support for your PRP program. Thank you for taking the time to watch this presentation. If you are considering PRP options for your practice, an easy next step is to schedule a brief, focused conversation with Transcend Biologics about how the TropoVet PRP system might align with your current workflows and service lines. In a short call, you can review your procedural needs and operational questions to help determine if this next-generation PRP preparation system is an appropriate fit for your patients and your team. To request additional information, explore training opportunities, or discuss implementation details, please contact Transcend Biologics using the email, phone number, or website listed on this slide.